Hi everyone, and very good evening to all of you. First of all, the reason of coming live 2 days before the exam is because of the huge amount of anxiousness I could see in everyone's eyes. And when you message me up, it really, doesn't help you to come out of their comfort zone. Everyone is out of the comfort zone. They are not actually in their respective true minds. So let's talk about this. How can we make the things right? How can we make the things correct in the form of we can try at least not to make the silly mistake just because of panic episodes coming into our mind, or because of fear that can overshadow all our hard work in the last few months. To start this, I'll tell you this is just a 20-minute session. Just stay with me. We'll discuss all your queries, we'll discuss all your thoughts. Um, what I'll try to answer you here is to what are things you should take care of. I made a video in the morning as to how you should attempt a NEET PG paper. So that's a different video. To try to watch it, it will just take 5 minutes for you. And if you watch it 2x speed, it will finish in 3.5 minutes. Now, Perena, we should understand a few basic things that everyone preparing for the exam, everyone is so much anxious. There's so much in a fear कि what will happen. But एक बात समझो, in those 3.5 hours, that student gets a better rank who has held his nerve, who had just made himself or herself calm just by thinking positive. Now, it is very easy for me to say कि हाँ यार positive positive सोच लो, but as if you talk about the student's point of view, it's very difficult for you to understand हाँ सर इतना मैं positive कैसे देखूँ, इतना कुछ negativity मेरे आसपास घूम रही है. So one of them is, I will just tell you one thing. Forget about what has happened in the last year's exam. If you have attempted that, okay? Forget about your last GT results. Just forget about what may go wrong on the 5th of March. Think about, with just your calmness, you can surely make 2 to 3 questions extra correct. And the 2 to 3 questions, 2 questions into just 4 marks, 8 marks, will just jump your rank from here to here. So first thing you should all promise yourself is that I'll just stay calm. Yes, I have not read a lot, but NEET PG is not about reading so much. Please understand this thing. No one can say even before the exam that I have read everything. No one can say before the exam that yes, I know everything about the 19 subjects. No one can say that. So sir, what is the difference? Why do some students get very good rank and some do not? Some of the students they feel कि यार मैंने तो पढ़ाई करा है but at this point of time I don't remember anything. And that negative thought, what happens is when a question comes in front of you, you're not thinking sane. You're thinking अरे मैंने तो कुछ पढ़ा ही नहीं है. That the overshare that comes to your mind, and therefore you're not able to rule out the option even though the answer is in front of you. You're not able to see that because something else is overshadowing your mind, and what is overshadowing your mind is number one, that you have not been able to revise very well in the last few days. ऐसा कुछ नहीं होता. ऐसा कुछ नहीं होता because being a ranker myself, when I cracked aims, I can tell you, last day before the aims, me and my roommate was sitting and just discussing अगर अगले कल को अगर हमारा सिलेक्शन नहीं होगा what to do. And we were in the top ranks into the AIMS entrance exam. So, one thing I'll tell you, just have that positive thought in yourself. Think about why you started this entire journey. And why you started was because you wanted to become a good doctor. To become a good doctor, your mindset is very important. You should not get, frightened by the sort or the sight of a patient presenting you with some chief complaint. This exam is like a chief complaint and will show you so many different types of issues there. So number one, I want all of you just promise yourself that you will not fear this exam. This, if that one thing is gone, I can tell you, you really feel good about yourself. And what you can, do better is just sleep on proper time today. I'll answer all the queries. I'm seeing a lot of them. I can see them so much in my telegram that I thought of discussing this with you. So one thing is common right now, and everyone is in that fear. But we can come victorious by our positive mindset. Positive mindset से क्या होता है? I'll share you one incident. When I was appearing for the SRship exam, after the AIMS you do an MD, then you have to post an SRship exam before you do a SRship in the subject. So in that point of time, I was also not well prepared. But throughout the 3 years of my MD, I had read very well. I could not study at all in that time because of the our SRCHF exam coincided with our MD exam. So we cannot discuss, we cannot solve any of the MCQs. But I just thought in myself कि मैंने पढ़ा तो है, तो why to even bring about the negative thoughts? Let's think positively. And every question that came to me, I just thought about, let's rule out this option. It cannot be A, it cannot be C. And the first thing that struck to my mind, the option B, I just marked B. Because it's all about instinct. Instinct is not guess. Do not confuse this instinct and guesses. Instinct is something, when you see a question and you've read it before, that's an instinct. Guess is you have never seen a question, you have never seen the options, and just guessing it blindly. B B B mark kar diya. So I know, because I have taught you all for so many months. I know that most of you have studied very well. What is troubling you right now is the grand test result, isn't it? So don't worry about it. GT result is different, and this exam is different because the exam doesn't have so many close options. The exam doesn't have a lot of controversial questions because they know, the examiner know that they can make easy question, that also they can differentiate someone who has studied and someone who hasn't studied, someone who is thinking positively now and someone who is just not able to think in a sane mind because of the negative energies coming into him. So guys, from the bottom of my heart, I'll tell you one thing: please think positively. This is a time you should tell yourself, yes, I can do it. The time you should tell yourself that all of the negative energies around you, I can come out victorious. This is one thing you must tell yourself, because this moment is only yours and no one can take it from you because you are preparing for the exam. Let not others tell you that you will not be able to crack it, and let also you not tell yourself कि यार मुझसे तो नहीं होगा. अगर तुमसे नहीं होगा तो किससे होगा? We all students like us only get good results. Yes, I don't want rank 1. I don't want rank 2. I don't want rank 5. I just want a good result. I can get a seat of my choice, isn't it? And that seat of your choice will surely come to you by that positive energy in yourself. So do not feel anxious. I can see a lot of messages telling me, sir, I'm not able to revise everything and anything. What I should do? Kuch mat karo. Tomorrow, just focus on the last 2 years of NEET PG question. That's it. और कुछ मत पढ़ना. Okay? The GT जो तुमने दिया है, mistakes छोड़ दो, भूल जाओ. The 20th notebook, you're not going to write everything, कोई बात नहीं, छोड़ दो, भूल जाओ. Because what you must understand is, if reading only on one day will make some big changes, then everyone will be reading only for the last day and no one will be reading for the last few months. So you all have read so much. Please think positively right now. I want all of you to please have that attitude. Yes, I can do it. एक बार अपने आप को बोलो तो ये चीज कि yes, I can do it. Because हो क्या रहा है ना, that it's a vicious cycle now. I'm thinking I cannot do it. I'm thinking it about a lot. So I'm not able to sleep properly. And therefore, while I'm not able to sleep properly, I take up my mobile phone, I look at the messages, and again go back into negative thought process. Negative thought process, anxiousness, mobile phone, again negative thought process. So I'm there with you. I'm telling you this thing. It has happened to all of us. And throughout the last few years, what I've noticed is that everyone tells me, I just used to ask them, weren't you afraid before the day of exam? They said I was very much afraid. They said, then I asked them, then what made you think positive? I said, sir, आप लोग थे ना हमारे हमें बोलने के लिए कि just don't be afraid of the exam. And all the negative energies, I just blocked it. I used my mind to block the negative energies, thinking about what can go better in the exam. So just imagine yourself sitting in that classroom in which you have a computer screen in front of you with a mouse and you attempting every question on its merit. How to attempt a paper, I have made a separate video. Do watch that. I'll put that and pin that video in the description below also. You must do that. Okay, अब देखो, what I can do very quickly is that, if since you all are here, in a very in just 5 minutes, I will discuss all the questions of the NEET PG of pathology and related topics in just 5 minutes. Okay, just give me 5 minutes and see how much you all remember right now. Okay, just discuss with me. This question came in the last years of NEET PG, discussing that a patient has developed lymphoblast and has decreased urine output. So discussion was on acute leukemia, and the patient had a history of something in which he had tumor lysis syndrome. The best therapy of tumor lysis syndrome is hydration. Remember, the best therapy is hydration. Second question was asked whether the patient has frequent falls and has difficulty in getting up from squatting. So whenever you get this history in a 4-year-old boy, think about a extreme recessive disease, that's Duchenne muscular dystrophy. In Duchenne muscular dystrophy, look at the small muscle size here compared to the large muscle size that you see here. Okay, so in this case, what is true is asked, and death can occur by the third decade. Remember, was the right answer. I'm not discussing anything in detail. I just want you to brush up the last few things that is remaining there. Okay, secondly, A middle aged female died of COVID-19 infection, and on ventilator she was placed. And what is the lung autopsy showing? It's a history of ARDS, and in ARDS what you see is a basically there is a thick fibrin lining the alveoli, and that is called as HMD or hyaline membrane disease. Okay. Next question was asked in last year's NEET PG, in which the patient had a reduced RBC indices, fatigueness, microcytic hyperchromic anemia, and there was a hemoglobin of 10, low MCV, low MCH, and also slightly low MCHC. And when you look at the RBC count of 5.2, the Menzer index is 10. So देखो, when the Menzer index is more than 13 is iron deficiency anemia, Menzer less than 13 is pointing towards a thiol trait. And if it is thiol trait, it will, what is the next step to do? You must do HbA2. Okay, you must do HbA2. That's one thing that you must also be aware of. Okay, next one. So next question was asked in, देखो अब ये question है कि whenever you get a question like this, a 50-year-old patient with hepatosplenomegaly, high TLC, देखो this question will surely be asked. There's no exam till now in the history without a question of CML. अब CML दिखेगा तो एक ही हाथ से बनेगा, that's translocation of 9 with 22. Translocation of 9 with 22. Okay, that also is done. अगला question पूछा था, there's a short multiple yellow white plaque in the bladder. Now this was a new question asked last year. The same can be also repeated this year, and it was a history like this. These all black deposits, actually they're concentric deposition inside the macrophages. It's a case of malakoplakia. Malakoplakia is a chronic inflammatory lesion of the bladder, and it's seen because of concentric calcification. The etiological agent is Escherichia coli most commonly. बस इतना याद रखना, not more than that. Next question is now, this again was a new question. देखो, there's infertility and semen analysis shows azoospermia. तो azoospermia है, infertility है, is not a tumor which can lead to like seminoma. Okay, it cannot be yolk sac tumor. Okay, so now what you're saying is round are the seminiferous tubules, and in the seminiferous tubules what you find is a Sertoli cells, but between them there's an empty space here. There's no cells you see between these seminiferous tubules, and hence it becomes a case of Sertoli cell only tumor. It becomes a case of Sertoli cell only tumor. Okay, that's how you must solve the question. Remember, in Sertoli cell only tumor, the Leydig cells are absent, and the Sertoli cell increase so much that the patient actually are not able to nourish the sperm because Leydig cell releases LH. Because low LH, the patient suffers from infertility. Okay, और कुछ नहीं जानना है इसके बारे. A patient has swelling in the front of the neck, came to clinic, complains of fatigueness, there's hypothyroidism and anemia. अब देखो, a patient has hypothyroidism, what type of anemia you expect? You expect macrocytic anemia. Okay, इसमें कहीं कहीं पर आंसर एक iron deficiency anemia दिया हुआ था. It's a wrong answer. Remember, अगर hypothyroid है and the case of anemia, it will be a case of macrocytic anemia only. ये भी solve हो गया. Next question पूछा गया था, palan fatigueness, a known case of hemorrhoid was there, and the hemoglobin is low. The peripheral smear pathology is shown below, and look at the image here. The moment you see this type of cell, what is it, beta? It's a pencil cell. Pencil cell with a microcytic RBC, what it points toward? It points towards microcytic hyperchromic RBC. If you ask diagnosis, it would be iron deficiency anemia. And what test to do? Do serum ferritin levels, which will be low, and total iron binding capacity will be high. Iron will be low, and saturation will also be low in a case of iron deficiency anemia. What else can be asked? The most sensitive specific test, it is ferritin levels. अगर stain is asked, it's pearl stain, also called as Prussian blue stain. इतने से आता ज़्यादा क्वेश्चन नहीं पूछा सकता आपको. Okay, next. Next, a 30-year-old patient presents with fertility for 1 year. Evaluation has mild anemia, massive splenomegaly with TLC, and neutrophil is 60%, eosinophil is 4%, lymphocyte is 15%. ये क्या point कर रहा है? It is again pointing towards a chronic mild leukemia because of myeloid hyperplasia, and therefore the best test and the most sensitive test is fish and polymerase chain reaction. If the question will be next test, अगर next पूछते, the answer will be lab score. Now because the question is most sensitive test, it will be fish and polymerase chain reaction. Last to last question here, sensitive and specific. In that case, again the answer becomes fish and PCR. चलो ये भी solve हो गया. Next question was, a patient with webbed neck, shield chest, and short stature. The moment you see this, answer becomes Turner syndrome, because Turner syndrome का simple mnemonic याद रखना, clowns. याद है ना clowns, जहां पर you have to remember that the patient was surely present with webbed necks, shield shaped chest, and the short stature will be also there. Okay, now remember, in the Down syndrome is the only syndrome which has intellectual disability. The patient of Turner syndrome, the most common cardiac anomaly is the bicuspid aortic valve, more common than the coarctation of aorta. And secondly, you must remember that the most common cardiac anomaly in case of Down syndrome is the एट्रियल सेप्टल डिफेक्ट, द एंडोकार्डियल cushion defects. Okay, एक क्वेश्चन आया था about Marfan syndrome. The Marfan syndrome patient who had a case of superotemporal subluxation lens in and should be compared to the homocystinuria, which is infromedial subluxation of lens. But all these cases do not have intellectual disability. The only case with intellectual disability is Down syndrome. इतना ध्यान रखना बस. Okay. अच्छा. Next, this is a case of a patient with cytoskeleton of chronic alcoholic patient with decreased liver span, and the patient had a history of alcoholic liver disease. So alcoholic liver disease shows what? It shows, yes, it shows the Mallory-Denk bodies, and Mallory-Denk bodies has what? They have cytokeratin, and cytokeratin is what? It's an intermediate filament. If it is asked what stain will you use, it is cytokeratin 8 and 18 is often positive in such cases. That's it. इससे ज़्यादा याद नहीं रखना है. Okay. And what are the other causes of this uh, the Mallory-Denk body is a simple mnemonic is weight in PHC, Wilson, alcoholic, Indian, childhood cirrhosis. It is T is trypsin deficiency, and the P is primary biliary cirrhosis. It's not secondary, it is primary biliary cirrhosis and hepatocellular carcinoma. Bas, is that next was a patient diagnosed with red cell aplasia. This was a last year's NEET PG question. And what is the most prevalent cause? It is thymoma. Remember, thymoma is one of a paraneoplastic syndrome which can lead to pure red cell aplasia. Okay. Okay, one more thing, that the infection which can cause PRCA is what? It is parvovirus B19, especially in a case of severe hemolytic anemia. ठीक है. अगला क्या रखना है? Pap smear with hyperchromatic nuclei, pleomorphism with low maturation index, complete epithelial lining, not invading basal membrane. What is it called? It's a case of dysplasia. Dysplasia और alopecia में difference क्या है? Anaplasia is a complete loss of differentiation. Dysplasia is a just involving the lower 1/3, mild, lower 2/3, moderate, full thickness is severe, and severe dysplasia is called as carcinoma in situ. बस इससे ज़्यादा नहीं याद रखना है. Okay. A 34-year-old woman with fever, migratory arthritis, and large joints has tachycardia, murmur is pansystolic, and mitral regurgitation is present. The biopsy shows the following. क्या दिख रहा है ये? It's a Asher body. The moment you see inflammatory cells inside the myocardium, it becomes a Asher body, and Asher body is seen in rheumatic heart disease. याद रखना. From last 2 years, they are asking you the secondary prophylaxis of the rheumatic heart disease. You have to understand it is that without carotis, with carotis, and with carotis with the valvular damage. The answer can be either 18 years or 21 years. Both of them are correct. Obviously, they will not give you both the options, but supposedly there is both the option 18 and 21 years. Better go with 21 years, as Indian textbooks mainly mention 21 years of age. Okay, there's one thing you must also remember there. Okay, अगला क्या है? A poor prognostic factor for multiple myeloma. These all are NEET PG question I'm discussing. Only PYQ I'm discussing. Okay, I'm not discussing something from my own head. These all are PYQ. तो ध्यान से सुन लो और फिर सो जाना. ठीक है. Multiple myeloma, poor prognostic indicator is beta 2 microglobulin. In multiple myeloma, what are the question asked? They can show you plasma cells, they can show you flame cells, they can show you grape cells. Okay, poor prognostic marker is beta 2 microglobulin, and they can ask you the CRAB finding. CRAB क्या है? Hypercalcemia, renal failure, anemia, or bone lytic lesions. Else what they can ask you? They can ask you CD marker, which is CD38 and 138. बस, don't remember more than this. Okay. अगला क्वेश्चन क्या है? A patient has gum bleeding and EC bruisability and fever for last 2 months. Okay, 2 month की history है. The patient has significant pallor and petechial rash all over the body. Hemoglobin is 3. TLC is also low and platelet also low. So they have pancytopenia. The moment it becomes pancytopenia, there's only one answer. It's idiopathic acquired aplastic anemia, because the question is pancytopenia. But remember, sir, pancytopenia can be seen in myelodysplasia also, PNH also, and TB also. Yes, it can be there. But the point is, the bone marrow examination shows fatty streak and absent megakaryocytes. That means pancytopenia with hypocellular bone marrow. That is very simple trick. The moment you get a question of pancytopenia with hypocellular bone marrow, is only one answer. It's aplastic anemia only. There is no other answer possible with a pancytopenia with hypocellular bone marrow. And if it is asked, definition of hypocellular bone marrow is 25% or low. Bus. Don't remember more than this. Okay. Chalo, this is all about the NEET PG questions. I'll also discuss with you the FMG questions. Yes, FMG question बहुत बच्चे ढूंढ रहे थे. I will just discuss in short the FMG question. Okay, I'm just seeing all your doubts here. I'll just take 5 minutes more after this one, and this all are FMG question. Okay, FMGE January 23 questions. Okay, I'm discussing that with you. Only answer I'll discuss. और उसको ज़्यादा ज़्यादा PDF वीडियो के चक्कर में मत पढ़ना. Just know the answer और सो जाना. Don't again look at this. खत्म हो गया. Okay. But I'm seeing all your doubts. I can take that after this also. Let's just move ahead. I have just promised you 20 minutes, and 20 minutes are all over. I'll just take 5 minutes more from you. Okay, देखो. So a patient has a chronic backache, fatiguity, and headache for the last few days. And look at this type of cell. देखो, this type of cell. It's a cell with a, yes, eccentric nuclei, or this is a HOF. It's case of multiple myeloma. Okay, it's a case of multiple myeloma. Simple case है, plasma cell or multiple myeloma. अच्छा, so patient hypoalbuminemia, edema, hyperlipidemia, proteinuria. This periorbital region has a edema, and the patient was given steroid therapy, and disease goes away. Renal biopsy of light microscopy was unremarkable, but electron microscopy shows effacement of food process. क्या बना? Yes, it is minimal change disease. It becomes a case of minimal change disease. Okay, minimal change disease. ठीक है? Okay, 3. A 65-year-old man was admitted with emergency with severe onset of chest pain. Okay, with severe onset of chest pain. Now the patient has autopsy, the heart was taken out and immersed in a solution. So what stain you use to diagnose a myocardial infarction? The answer is yes, TPTC, triphenyl tetrazolium chloride. Triphenyl tetrazolium chloride. Okay, triphenyl tetrazolium chloride. ठीक है, अगला क्वेश्चन. नाउ दिस इज अ टीपीटीसी डाइट टेस्टिंग, जहां पर वेर यू सी द पेल एरिया इज अ इन्फार्क्ट एरिया एंड द रेड एरिया इज अ नॉर्मल एरिया. ध्यान रखना, इज बेस्ड ऑन विच एंजाइम टेस्टिंग? लैक्टेट डी हाइड्रोजनेज टेस्टिंग इज टेस्टेड फॉर द टीपीटीसी डाइट टेस्टिंग. ओके, अच्छा. नेक्स्ट क्वेश्चन इज द फॉलोइंग इम्यूनोग्लोबुलिन हैज द मैक्सिमम कंसंट्रेशन. एक सिंपल न्यूमेरिक याद रखना, गैमडे, GAMDE. मैक्सिमम इज IgG, देन A, देन M, देन D, देन E. तो आपको बस ये है मल्टीपल माइलोमा के लिए. Overall, the maximum concentration of the antibody also is maximally IgG is the maximum antibody. ठीक है. Next question. Macrophage are inflammatory cells and responsible for chronic inflammation. In liver, what are these macrophages called? Yes, it's a Kupffer cell. याद रखना. Kidney में it is mesangial cells. Ito cell are the vitamin A storing cell, and histiocytes are in tissue. Other than that, in brain it is microglial cells. Okay, in brain it is microglial cells. Also is a macrophage. Acha, this question is a patient has headache and radiological investigations revealed a frontal dural tumor, and what you see in the same, these all are. अब ये देखो, देखने से लग कैसा रहा है? It's a keratin pearl like, but it's not a keratin pearl. But if you see these cells, they're round fashion like this. Okay, and देखो, अगर it is keratin pearl, it should be squamous cell carcinoma, and squamous cell cancer doesn't occur in the brain. In brain, what do you find? Meningioma, and hence it's a case of meningioma with some bodies around it. Obviously, you have to look at the history also. Yes, initially when you look at this question, it can look at some of you as keratin pearls. I agree, it is keratin pearl. As a lag raha hai, not keratin pearl actually, but looks like keratin pearl. But the history is pointing towards a brain tumor, and brain tumor doesn't have squamous cell carcinoma. It has to be meningioma, showing you this psammoma bodies. Okay, this is an indicator of what cell? It's a, yes, it's a owl eye appearing cell. It is seen in cytomegalovirus. Owl eye appearing cell seen in cytomegalovirus. ठीक है, याद रहेगा. अच्छा, it's where else you see the owl eye appearing cell? Other than this, you can see owl appearing cell in a Reed-Sternberg cell in a Hodgkin's lymphoma also. They also look at the same. ध्यान रखना, it's also very important to understand. अगला, splenectomy is indicated with the following hemolytic anemia. अब ध्यान रखना, obviously splenectomy is indicated in ITP also, but because the question is asking you hemolytic anemia, ITP is not hemolytic anemia. Therefore, इसका आंसर क्या होगा? Hereditary spherocytosis. The answer is hereditary spherocytosis. In this year also, an ICT question came that spherocytosis prevents or decreases hemolysis. In a case of, answer was hereditary spherocytosis. One more thing, spherocytes are a type of RBC in which the MCHC is raised. ध्यान रखना. This question was asked in last year NICT. It can be repeated also. That in which of the type of RBC the MCHC is high. There's only one cause, and that is spherocyte. Whereas all other type of anemia have low MCV, no, not only low MCV, low MCH, and also low MCHC. Okay. The formula also of MCH and MCHC is important. एक simple ध्यान रखना. MCV is volume of the RBC. MCH इज हीमोग्लोबिन पर आरबीसी. तो क्या होगा, हीमोग्लोबिन बाय आरबीसी काउंट. और एमसीएचसी क्या है, हीमोग्लोबिन पर यूनिट वॉल्यूम ऑफ आरबीसी. तो क्या होगा, हीमोग्लोबिन बाय पैक्ड सेल वॉल्यूम. बस इतना याद रखना है. ओके चलो. अच्छा, कैन यू आइडेंटिफाई द एंट्रेंस पैटर्न हियर? लुक एट द रेड वन इज अफेक्टेड एंड ब्लू वंस आर नॉट अफेक्टेड. So what you do, you apply my simple rules, Dr. Praveen's 3 rules. My rule number 1 was mitochondrial hai ki nahi. So is it mitochondrial? No, not mitochondrial. Why? Because the males are transmitting disease. Second rule, go from down to up and see dominant है recessive है. Is it dominant? Yes. कैसे देखना है? One of the parents are diseased. Yes. यहाँ देखो, one of the parents are diseased. Okay. इन दोनों को देखो, one of the parents is diseased. तो क्या मिला ये? Dominant. Now see for the male transmitting to male. Do you see anywhere a male transmitting to male? Yes sir, यहां दिख गया. तो can it be X-linked? No. क्या बना? Autosomal dominant. Simple rule, 1 minute can solve all the question. चलो, very good. अगला, characteristic feature of hemolysis. Reticulocytopenia, no. Reticulocytes increase, नहीं हो सकता. Decreased haptoglobin, surely. Neutropenia is not the answer. Therefore answer क्या होगा? It is decreased haptoglobin level and occurs in which of anemia? It occurs in intravascular hemolysis mainly. चलो, TAM protein is what type of cast? It produces what type of cast? Produces the hyaline cast. Cast is very very important. एक बार cast का फटाफट रिवीजन कर लेते हैं. The which of the following cast can be physiological? Answer is hyaline cast. ठीक है. Remember, there is nothing called as elastic cast. Don't worry about it. The waxy cast is seen in chronic renal failure and can be seen in a case of a severe renal failure also. The RBC cast can be seen in glomerulonephritis. WBC cast is seen in tubulointerstitial nephritis. और एक क्वेश्चन आ सकता है ब्रॉडकास्ट. ब्रॉडकास्ट is seen in chronic renal failure. Okay. अब क्या क्वेश्चन है? A 50-year-old patient has OPD with headache, she was afebrile and finding it was tumor of 22 centimeter. Okay. Now the patient has a tumor of 22 centimeter at dura mater. The moment you see a tumor attached to the matter, you remember radiology, it's a Jura-tail sign and hence it is meningioma. So we'll show you concentric finding of meningioma bodies. Acha, where you see Antony A and Verroque bodies? Schwannoma. Yes, schwannoma. Yolk sac appearance, that is actually the fried egg appearance, is seen in oligodendroglioma. Oligodendroglioma. अच्छा, अगला क्वेश्चन क्या पूछा था? A 44-year-old female has suffering with wheezing, cough every year and at the same time. Which of the following cell will be responsible for this type of finding? Simple answer is mast cell degranulation will release what? Histamine and will lead to such type of asthmatic findings everywhere. Okay. अगला क्वेश्चन क्या था? सिकल एनीमिया. ये तो तुम गलत कर ही नहीं सकते. ग्लूटामिक एसिड रिप्लेसेस वैलिन एट द 6th पोजीशन. ओके, ग्लूटामेट टू वैलिन एट द 6th पोजीशन ऑफ द बीटा चेन. दैट्स अ सिंपल आंसर ऑफ सिकल एनीमिया. इन सिकल सेल क्वेश्चन जो लास्ट में पूछा गया है, दैट व्हाट इज द मोस्ट कॉमन प्रेजेंटिंग साइन? रिमेंबर, इट इज पेनफुल डैक्टाइलाइटिस. ओके, पेनफुल डैक्टाइलाइटिस द मोस्ट कॉमन प्रेजेंटिंग साइन. और क्या पूछा गया है? लास्ट ईयर क्वेश्चन, फुटबॉल की हिस्ट्री थी. पेन इन द legs while playing football, and that point towards the sickle cell anemia. What else can be asked? Initially the spleen size is high and then spleen size is reduced because of autosplenectomy. Last NEET PG question also was, if a patient has a joint swelling, the aspect of the joint will most likely show which of the following infection. The answer was Salmonella typhi. If the question is the most common cause of lung infection, it is Streptococcus pneumoniae. बस इसे तो याद नहीं याद रखना है. ओके, चलो. द फॉलोइंग इज इन्वॉल्विंग एक्सट्रिंसिक पाथवे. एक्सट्रिंसिक में सिर्फ एक ही है, ओनली एक है, दैट इज फैक्टर 7. एंड इंट्रिंसिक में क्या है? 12, 11, 9, 8. ओके, एंड हाउ डू आई मेक यू रिमेंबर? आई मेक यू रिमेंबर एज कॉमन पाथवे. कॉमन पाथवे स्टार्टिंग फ्रॉम 10. 10 का हाफ 5, 5 का हाफ 2 और 2 का हाफ 1. स्वाहा. दैट इज व्हाट यू मस्ट रिमेंबर फॉर कॉमन पाथवे. 10, half 5, half 2, half 1. That's common pathway. Extrinsic only has factor 7. Okay. चलो और क्या क्वेश्चन था? अ पेशेंट विथ हेमाचूरिया इडीमा हैज हिस्ट्री ऑफ इन्फेक्शन 10 डेज बैक। हेमाचूरिया मिल गया, इडीमा मिल गया, एंड हिस्ट्री ऑफ इन्फेक्शन 10 डेज बैक क्या मिला? पोस्ट स्ट्रेप्टोकोकल ग्लोमेरुलाइटिस, पीएसजीएन। रिमेंबर, if the question will be 1 to 2 days before, as it becomes IgA nephropathy. MGN, MPGN will not have such history of the case. MPGN can show you, yes, dense deposit disease and trunk trap appearance. MGN will show you diffuse GPM thickening. Bus, nothing else is required for that. Okay. Sensitive and specific marker for intestinal inflammation. The same can be also asked sorry, with a history of inflammatory bowel disease. The IBD के लिए or any inflammation के लिए the best marker now available is calprotectin and lactoferrin, and they are seen in which testing? In fecal. They are seen in stool testing. Okay, stool may you can look for calprotectin and lactoferrin. They also are used as prognostic marker in case of celiac disease and the ulcerative colitis. The question can be asked, the most hallmark finding of not celiac, sorry, Crohn disease, very sorry, Crohn's, not celiac. The hallmark finding of Crohn disease is what? Non-caseating granuloma. Okay, that is one question that can be asked. Okay, fecal elasticity is not a very specific marker. Lactoferrin and calprotectin are a better marker for looking for inflammation. ठीक है? अच्छा, image based question. This is the owl eye appearing cell, can be seen in, as I told you, the infection of Epstein-Barr virus, or can be seen also in the Reed-Sternberg cell as a finding of Hodgkin's lymphoma. Okay, Zhang smear. तो Zhang smear में क्या करते हैं? The bulla is broken, and with the help of a small this glass slide, just scrape the lesion, and the lesion is then seen in a microscope after staining with the Giemsa staining. तो उसमें क्या मिलेगा? You will see what is a finding of herpes simplex virus HSV 1 and 2. Remember, the Zhang smear can also be used for pemphigus, where you see acantholysis. Acantholytic cell will be all round and they won't be together. There is non cohesive. Its non cohesive cell is called as acantholytic cell, is a feature of pemphigus. Is also diagnosed by a case of Zhang smear. Okay, a 20-year-old patient with past history of infection, hematuria, KFT range, and elevated creatinine. Anti-GM antibodies positive. क्या बना? It surely is a case of good Pasteur syndrome. Good Pasteur syndrome. बस. That is all about the FMG questions also. अब इसका PDF के चक्कर में मत पढ़ो. Just listen to me carefully and just go to sleep. I just take a few discussion that I just saw in between. The first question was crypt abscess for ulcerative colitis. Yes, crypt abscess for ulcerative colitis more than Crohn disease. Okay. Fecal elasticity मैं आंसर कर चुका हूं आपको. How to revise tumor, I'll talk about this just now. And thank you for the inspiration. Thank you guys. हाँ, बीच में ऊपर में काफी क्वेश्चन थे. 100% श्योर, एंड इफ टू ऑप्शंस रूल्ड आउट, देन व्हाट टू डू? बेटा देखो, इफ यू आर एबल टू रूल आउट टू ऑप्शंस, गो फॉर द क्वेश्चन. इतना कॉन्फिडेंस तो है ना, कितना पढ़ा है तुमने, गो फॉर द क्वेश्चंस. ठीक है? नाउ वट एवर कम्स फर्स्ट योर माइंड, मार्क दैट आंसर. डू नॉट डेयर चेंज इट. डू नॉट डेयर चेंज इट. जो मार्क कर दिया कर दिया, because you know the answer. That first thing that comes to your instinct is because of a subconscious mind. Do not change the answer. But suppose the factual question, you've never seen that, you do whatever you want to. God will help you to get it correct or wrong. Don't worry about it. इतना क्या वरी करना है, टेंशन मत लो. I'm reading and unable to recollect anything in my memory. एक बात ध्यान से बताओ जवाब. When I was discussing these questions, were you not able to solve the answer? Yes. अरे क्वेश्चन इतना ही इजी आता है. Just by positive thinking and clear thought, you'll get all the answers. Question ऐसे ही रहेगा. Clinical questions, but straightforward questions. But don't overthink. Don't underthink, don't overthink. Overthink करोगे तो you will change the options. I'll get wrong. Underthink करोगे, you will, even without looking at the question, you will mark an answer. You will miss a negative history. You will miss a age. You will miss the sex, and you will miss the except at the last. So underthinking is also bad. Overthinking is also bad. ध्यान रखना. Do not overthink, don't underthink. इसीलिए it's very important to maintain timing of every question. How to attempt NEET PG paper, I have made a video, उसको please देख लो, उसके अनुसार ही पेपर attempt करना. Okay? Is it possible to revise in just one day? One day में रिवीजन करना ही नहीं है तुमको. अरे you have read for everything for so many days. Just relax now. Tomorrow, just look at the last 2 years of NEET PG paper PYQs. बस. And do not solve it. एक और गलती मत करना. Don't solve the question. Question देखो, आंसर देखो, खत्म, डोंट सॉल्व, बिकॉज इफ यू सॉल्व द क्वेश्चन एंड सपोज यू गेट 15 रॉन्ग आउट ऑफ 50, बेड़ा गर्क, फिर अगेन टेंशन होगा, मत ही जाओ टेंशन पे। सर इज फॉस्फोर रिवाइज वाइप, यस व्हाई नॉट, रिवाइज वाइप करो। इफ इट इज पॉसिबल फॉर यू टू रिवाइज वाइप, आज से शुरू कर दो। डू रिवाइज एनाटमी, पैथ, फार्मा, पीएसएम केम इज वेरी वेरी इंपॉर्टेंट, सर्जरी, गायनियोप्स, and short may do revise dermatology, ortho, and radiology. You can also discuss with that. Okay. um, so हाँ, और क्या था? नहीं नहीं, पैनिक एकदम नहीं करना एग्जाम के समय, तुमको पैनिक नहीं करना। मैं बता दूं मेरे साथ क्या हुआ था, रियल स्टोरी। इन माई एम्स एग्जाम, आईआईएमसी तो उसमें नहीं था। फर्स्ट क्वेश्चन नो आइडिया, सेकंड क्वेश्चन नो आइडिया, थर्ड क्वेश्चन नेवर इवर हर्ड अबाउट इट, 1 2 3 4 5 6 कुछ समझ में नहीं आ रहा था। डीप ब्रेथ्स, calm yourself, attempt the paper now. Next question, I have read this. Next question, I know this. Next question, I don't know. कोई बात नहीं, I will not waste time in that. Next question. तो अपने आप को थोड़ा सा कॉन्फिडेंस तो दो यार, इतना तो पढ़ा है, इतना कॉन्फिडेंस तो तुमको मेंटेन करता है। पेशेंट विल कम टू यू फॉर ऑपरेशन, एकदम पैनिक कर रहा है, अब मैं क्या करूं, ऐसे नहीं होगा। यू हैव टू मेंटेन योर कामनेस, दैट इज अ ब्यूटी ऑफ अ डॉक्टर। प्लीज मेंटेन दैट, डोंट बी पैनिक, डू नॉट थिंक नेगेटिव। ओके। Most specific test for celiac disease, that's a anti-GDG is most sensitive, and endomysium antibody is most specific. Okay. Do I solve important modules or now revise? No, 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 no question at all. Do not solve any question tomorrow. Promise me that. No one will going to solve tomorrow question. No one, no one at all. So non-Kisning granuloma can be seen in endoscope. No, 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 beta, it is seen in biopsy only. Okay, don't see that in endoscopy. अगर वो दिखने लगे तो पैथोलॉजिस्ट क्या करेगा बेचारा? Yes, surely we are praying for you, बेटा. नेक्स्ट स्टेप फॉर एल एल एम एल, एक बार ध्यान रखना कि अगर क्वेश्चन पूछ रहे हैं स्टार्टिंग फ्रॉम द पेरिफेरल सिग्नल एग्जामिनेशन, हिस्ट्री दी हुई है, नेक्स्ट टेस्ट पेरिफेरल स्मीयर। ओके। इफ द पीएस हैज मोर देन 20% ब्लास्ट, डू बोन मैरो, सॉरी डू इम्यूनोफिनोटाइपिंग। इफ पेरिफेरल स्मीयर हैज लेस देन 20% ब्लास्ट, डू बोन मैरो इवैल्यूएशन। समझ में आया? वापस सुनो, फर्स्ट टेस्ट पेरिफेरल स्मीयर, अगर 20% मोर देन ब्लास्ट इज देयर, डू इम्यूनोफिनोटाइपिंग, and less than 20% do bone marrow evaluation. ओके। फिर क्या है? सर ऐसा लग रहा है कि भूल गई, इज दैट कॉमन सर? हाँ देखो मैं बोलता रहा हूँ, देखो ऐसा लगेगा बट ऐसा होता नहीं है। वाई इट हैपेंस लाइक दिस? बिकॉज वी आर लुकिंग एट 19 सब्जेक्ट्स, and 19 subjects are very difficult to remember. This imagine, because you all have done a prof exam also. Prof exam के एक दिन पहले हम क्या करते थे? We had only one viva of medicine, और हम ऐसे करके बैठे रहते थे, हे भगवान कल क्या पूछ लेगा, right? Remember that days? This is 19 subjects. It is bound to feel like that. It's natural. And when it's natural, don't think unnatural about it. It's natural ना, एकदम relax करो. Don't get anxious, एकदम relax करो. Everything will come to your mind. I'm telling you, those who remain calm, they'll surely be able to use their instincts. And instinct will solve 20 questions more than what you're doing right now. ठीक है? बेंजाइल पेनिसिलिन प्रोफिलैक्सिस, प्लीज देखो, अगर ये प्राइमरी प्रोफिलैक्सिस है, समझो बात को, इफ इट्स अ केस ऑफ प्राइमरी प्रोफिलैक्सिस, इन दैट केस आपको क्या करना है? You have to give benzyl penicillin only. And every secondary prophylaxis, and it is rheumatic fever without caritis, सिर्फ rheumatic fever है, you have to just give 5. You have to give either for 18 years of age or up to 5 years. If the question is rheumatic fever with caritis, 10 years, okay, or again 18 years or 21 years of age. And if it is rheumatic fever with caritis and valve damage, it becomes how much? It becomes 40 years of age, or even lifelong can be also be used for that. Okay. Thank you, Dr. Nachiket Bhatia sir, very very thank you to me, to you, thank you sir. Some questions which I used to get correct, I got them wrong. मैं बोलता ना 2022 is past, वो पुरानी बात है। अब न्यू में समझो, नया क्या है? न्यू इज दैट यू आर गोइंग टू अपियर फॉर द एग्जाम ऑन 5th of March. जो हो गया सो हो गया, फॉरगेट दैट, थिंक पॉजिटिव, थिंक पॉजिटिव। ओके। A tumor का बताइए रिप्रोडक्टिव सिस्टम एंड सर्जरी, मतलब अच्छा इतना बिल्कुल, तो हिंदी भी ऐसी हो गई है ना कि सर्जरी में, और फिर देखो इन गायनेकोलॉजी ट्राई टू जस्ट रिवाइज सर्वाइकल ट्यूमर्स, ओवरियन ट्यूमर्स, दीज टू आर मस्ट एंड मस्ट टू नो, ओवरियन ट्यूमर, सर्वाइकल ट्यूमर्स। सर्जरी में बहुत सारे ट्यूमर्स हैं, बट आई वुड आस्क यू टू जस्ट गो टू द स्टेजिंग ऑफ द पैंक्रेटिक, just a bit important. Testicular carcinoma ka staging is not important, so don't look into staging now. Okay, the basic idea is how to solve the question based on the PYQs. तो अगर क्वेश्चन PYQ का आ गया, उसका आंसर जान लो, that's it, and don't revise the staging also there. How to prepare for the NEET एग्जाम, उसका मैंने एक वीडियो बना लिया, उसको देख लेना जरूर से, ओके। और क्या है, लिम्फोमा और ल्यूकीमिया के बारे में बताइए बेटा, अभी तो टाइम नहीं है, बट जस्ट टू अंडरस्टैंड, ल्यूकीमिया में एक्यूट ल्यूकीमिया हो सकता है, क्रॉनिक ल्यूकीमिया हो सकता है। इफ एक्यूट ल्यूकीमिया इट इज ALL और AML, इन दैट केस CD34 will be positive. It's a chronic leukemia. If it's chronic leukemia, there will be a patient having 34 negative and is called as lymphoma or a case of CMPN. Okay, तो CMPN में क्या आता है, CML, पॉलीसाइथेमिया वेरा, एसिडोथर्मोसाइथेमिया and primary myelofibrosis, जबकि lymphoma as such is CLL and all lymphoma like mantle cell lymphoma, follicular lymphoma and the diffuse large B cell lymphoma and the Burkitt lymphoma also. इसमें क्या रखना है, just the biopsy finding और mutations, बस इतना ध्यान रखना, that's it. For leukemia, fish or biopsy, I told you best, if you ask me the best thing, the best is for diagnosis purpose, it is biopsy. But for prognostication purpose, it's fish. It depends on what the exact question is. CNS tumors में oligo astrocraniopharyngioma very confusing है. Don't read craniopharyngioma first of all. Read about oligodendroglioma which shows लिख लो fried egg appearance, and astrocytoma grade 1 is pilocytic, grade 4 is glioblastoma multiforme. ठीक है, इतना ध्यान रखना है. Sir, I'm doing PYQ with marrow explanation. Is it enough? देखो, I don't want to stress you out right now, but I'll just tell you tomorrow, don't solve a question. Just read the question and read the answer. Don't read it, don't solve it. Okay, just read it. Question देखा, आंसर देखा, बस. Don't try to exert yourself even more than that. इमेज में मैंटल जोन वर्सेस मार्जिनल जोन डिफरेंशिएट नहीं कर पाते हैं. मैंटल वर्सेस मार्जिनल तो इजी होता है बच्चे, इसमें क्यों गलती कर रहे हो. WBC मैंटल वर्सेस मार्जिनल इज इजी. लेट मी सी इफ आई हैव अ क्वेश्चन. हाँ, ये देखो, अच्छा इसमें मार्जिनल नहीं है, बट एनी हाउ, ऐसे मैंटल देख लो. दिस इज द पूरा GC एरिया. दिस डार्क लिम्फोसाइट हियर इज अ मैंटल जोन, और मैंटल के बाहर रहेगा मार्जिनल जोन. ओके, बट मार्जिनल विल बी लाइटर देन द मैंटल जोन. मैंटल इज द मोस्ट डार्केस्ट ऑफ ऑल द लिम्फोसाइट्स. ठीक है. So I'll just wind it off. I had really overshooted this session, so I wish you all the best. Just stay calm, be focused. Tomorrow, don't solve a question, read the question and the answers. A PYQ of last year of NEET, if you haven't seen that, it's the best to go to that. Or the 20th notebook, if you have prepared that, that's the second thing to do. If you have done the 20th notebook also, you have done the last 2 years of NEET PG question also, the third thing you should go and see is the vibe session of the image based questions. That's the third thing you can see there itself. Wishing you all the best. Take care. Don't be anxious. You are the winner. Just tell yourself, for everyone who has prepared with you, like faculty like us, your parents, your friends, your family, everything you have to just give them back. And what you have to give them back is just one promise, that you will not be afraid, you will not panic if you not are not able to solve the question. You will just do time management well and try to read every 200 questions in the best possible manner. God will tell us what will happen with our results, but please tell this to yourself and all of us who are preparing with you. Wishing you all the best. Take care and God bless you all. Bye bye.